Give us a brief overview of the rhinoplasty, augmentation and reduction rhinoplasty, please.
For the rhinoplasty, mainly consists for mainly two kinds of procedures. First is the augmentation rhinoplasty, and second is the reduction rhinoplasty. Augmentation rhinoplasty means patients who have flat nose, big nose, like in Asian people. The patient doesn't have any, dorsum. I mean, it's quite flat. So augmentation rhinoplasty involved with making the dorsum higher, like more Caucasian. Like Thai people who have flat nose, they want to have silicone implants and improve that to make the nose higher and looks, like more Western. But for the reduction rhinoplasty, it's mostly used in Caucasian people who have very high nose, very pointy nose. They want to make the nose smaller. So it's a different procedure in different kind of ethnics.
I see. So how long does it take for this procedure normally?
For the augmentation rhinoplasty, if we do it, just use only like silicone implants, it maybe just take 1 or 2 hours. But for reduction rhinoplasty, which consists of many detailed procedures, maybe about more than 10, 15 or 20 detailed procedures, it takes about 3 to 5 hours, depends on how complex the nose is.
I see. And what is the recovery like after the rhinoplasty?
I think it depends on the extent of the surgery. If you have only augmentation rhinoplasty, recovery might take only 2 weeks. But if you have the reduction rhinoplasty, you do a lot of things, quite extensive. It takes a long time for the recovery too. At least more than 6 months or to a year. Most of the nose, the swelling is gone, but the tip of the nose, which is the farthest part from the face, it takes a longer time for the swelling to subside.
I see. So the timing to see the final result is different.
Different, yes.
I see. Okay. So who is your best candidate, do you think?
I think the best candidate of the patient who have rhinoplasty is first they have to have good health. They're healthy, no underlying diseases, no bleeding disorder like that. And secondly is their expectations. They should have realistic expectations. Like some patients want to, like Thai patients, some patients want to have a nose like a Farang or Caucasian. Sometimes it's difficult, so it depends on, their expectations too.
I see.
Even the operation successful, but the patients might not be happy because they have high expectations. So it's very important that you have to have a realistic expectations, and you have to have a good underlying anatomy that can achieve the results.
Okay, so that's why it's important to have a talk with the doctor.
Yes, you have to have a consultation.
I see. Right. So what type of silicone do you normally use for the nose implants?
Actually, there are many kinds of silicones. They have both customized silicone, and they have already made silicones. So I have both kinds. So it depends on which kind of silicone is suitable for the patients. The silicone is high medical grade silicone. In my hands I have silicone from everywhere in the world. Korea, Japan, America, any kind of silicone. But I think the most important is how we use that silicone on the patient. Because every patient we have to customize the silicone to fit the patient.
Which is your own technique.
Yes,
I
right.
see. Can you please share with us the technique you use for the reduction or open?
Normally for the reduction rhinoplasty, you use open technique. It means that we have to open the nose, and you have to do a lot of details, procedures to make the nose and create a more refined nose shape.
I see. So, what the client should expect from this overall procedure?
I think for this kind of surgery, it's like normal cosmetic surgery that you have to expect. Like in the early stage, you have swellings, you have swelling, you have bruisings, you have some difficulty in breathing like that. But this symptoms will persist maybe 1 or 2 weeks after the surgery. And the swelling of the nose, like I told you, it might persist for 6 months to 1 year. So the patient has to expect that the results, to see the final results, it takes quite a time. You cannot see the immediate results in the first week after surgery. So you have to be patient because it takes time.
Right. It's not like just today and then tomorrow you can see the difference.
No.
I see. Wow. I guess that was lots of things to learn for all of you who has an interest for your rhinoplasty. So thank you very much.
Okay, you're welcome.
ขอบคุณค่ะ
สวัสดีครับ